Tammy Walker Cancer Center is part of Midwest Cancer Alliance, and at the annual meeting they showed the Someone You Love, the HPV epidemic video. They just showed a little part of it, and I was captivated by that, and that's really like the first I heard about it. And then I saw a map of the U.S. and which showed that Kansas had the lowest vaccination rates in the whole U.S., and I realized we were in a good position to work on this project. Yes, well, Midwest Cancer Alliance again is our partner, and they helped us get the movie both times. And then the first showing, we wanted it to be the medical community, and so we involved nurses and physicians and dentists and things like that. And the Salina Regional Health Center Foundation provided funding for the food, and Salina Regional Health Center helped with the advertising, and the Salina Art Center Cinema helped us with getting the cinema to show the film at. And then the second showing we did was for the public, and we had the same partners, except instead of using the Art Center Cinema, we used the Stiefel Theater, which was awesome. And we had a small committee, which I work on, and I work on the same committee with lots of different projects that I do with my outreach, and so we're kind of used to each other. It involves North Salina Community Development, Tammy Walker Cancer Center people, other medical people in the community, as well as survivors help us with these committees. We started the first one, the medical one, about 2 months ahead of time, and that was plenty of time as it was not a very big event. And then the second one we had about 3 months, and we made that, in addition to showing the movie, we had a health fair and talked about cervical cancer, breast cancer, those kinds of things at that health fair. So that took us a little bit more time to plan. The same people that helped us with the planning committee also were there to help us that day. I kind of had a plan in mind, and so I took it to the committee, and then we just worked it all out. You know, we're a small group, so we don't really have subcommittees or anything like that. And that seems to work out really well. Then our committee, I throw the idea out there, or someone else throws the idea out there, and then we all just talk about it and until we're happy with what the outcome is. We are so fortunate to be part of Salina Regional Health Center, and we have a wonderful foundation that helps us put on projects for the community, so they were there to help us. We also received many donations from the community for door prizes and things like that. We like to have door prizes because people like to have door prizes, and so they come when we have things like that. And we also like to have food. So Salina Regional Health Center helped us with the food. And then drug reps, we have drug reps that sometimes will give us things. And we also have contracts for cancer prevention activities with the Kansas Department of Health and Environment, which is in line with Kansas Cancer Partnership objectives. And so we get to use some funding for that. For the medical personnel event, we mailed out these nice postcards. I mean, they were really nice, and we had them for the doctors, dentists, clinics, and school nurses, and we had their names on them, and we mailed them out. And we also had a press release a few days ahead of time. We put out information on Salina Downtown, North Salina Community Development, Tammy Walker Cancer Center, Salina Regional Health Center Facebook pages. We use social media, and that's kind of how we did that. But and then the public one, it was on the same day as the Salina Arts Center First Thursday activities, which is a thing where people go around and look at art all around town, and they get food and they can purchase art if they want to at different places. But so that event, we use the same social media. There's a morning show on the radio that we've used, and they let me go on there for free and talk about community events. We partnered with the Salina Arts Center. That was a lucky thing because they put us in their advertising. They put our event in their advertising for that First Thursday event, so that was really fortunate. And then I also have a contact who's this wonderful person who works at the United Way, and she knows everybody in town. She has this huge email mailing list, and if you send stuff to her, she'll send it out. So we got the word out that way. And then we send it out to different factories or people that have big employee populations, and they'll post it for us. We have a thing called the Ashby House that are for women and who are displaced and have children, and also to just different entities. Oh, the Department of Children and Family Services, we sent it out there. So we also used an all-user email for the hospital, and that reaches up to like 2,800 people right there. The only thing is you have to get them to open the email. Oh, no. Actually, after that, we didn't get any negative feedback, and I didn't see anything on our social media either. However, I do go to health fairs, and occasionally I'll have someone come by, and they're like this, and no, we're not going to vaccinate. And you know, we always try to have a conversation, and I have them tell me what their thoughts are, and then I promote the vaccine, and sometimes we come to terms, and they decide to go ahead and get the vaccination. So those are the only negative things that I've been hearing. So the first one was for the medical community, and that was on Tuesday, June 16th, 2015, and we held it from 8 to 10 p.m., and that was the first time we showed the documentary. We had free hors d'oeuvres. Dr. Beck and Dr. Perez Tamayo agreed to have a panel for questions at the end, and Dr. Beck, actually, who is one of our medical oncologists, has been a champion for HPV vaccinations and has spoken up for it before. So anyway, the theater holds about 90, and we ended up with 40 attendees at that one. The second one was for the public, Thursday, January 7th in 2016 at 5 p.m., and the documentary started at 6:30 p.m. Prior to the movie, we had a health fair in the Watson Room, and we had food. Lilly Oncology brought Lilly Oncology on canvas prints and put them up on easels for everyone, so we could have this be part of the Art Rush thing, or the first Thursday Art Rush. And we took photos. We had a person that read a poem about cancer, and then at 6:15 we started encouraging people to head into the theater for the movie. We started out having over 120 people there, but only 44 stayed for the movie. We again had asked Dr. Beck and Dr. Perez Tamayo, and they were there and introduced the movie and talked about the importance of the vaccine for both boys and girls, and about the cancers that we're seeing in men and women. So we had Dr. Beck and Dr. Perez Tamayo, who are physicians here at the Cancer Center. They went up to the front and they introduced the film, and they talked a little bit about the importance of the HPV vaccination, the different cancers that the HPV vaccination covers, and they talked a little bit about cervical cancer because that's what we were going to see in the film. And they did stay around at the end for questions, but we had a few questions at the beginning too before we started. The attendees were universally moved by the documentary. The medical team, that group said that we needed to involve boys and men as well. One of the school nurses says it was life-changing and should be shown to the elementary and middle school parents. Pregnancy service center nurse said that this helps to eradicate the stigma with HPV being an STD, and another nurse said that she would love to involve the high schools. So it was really important, I think, for people. People thought that we needed to get it to a younger age group in the schools, and I thought that was really wonderful. For the public showing, we used our own surveys to delve a little bit deeper. We asked for a short review of the film. We asked their age. We asked if it changed their mind about the HPV vaccination, if they plan to vaccinate their children or get vaccinated themselves, and we asked them to share their thoughts. The age range for the viewing was pretty good, I thought, was age 17 to 71. I will say there were more women than men by far, but there were quite a few men there. The surveys were very encouraging. As with the first time, everyone was moved by the movie, and most said that they thought the vaccines were important and they would share the information with their family and friends, and they would make sure if they didn't have children or their children were grown, that they would talk to their kids or their nieces and nephews about this. It was very important. Many said it should be shown at the PTA meetings. Many said they would like a video like this for men, which I kind of agree, or at least include a segment maybe. One person said that this should have been more about the vaccine instead of just the disease. Most appreciated having the doctors there to answer the questions, and one said she was grateful that she had seen it with her daughter, and another one said it would help her influence her own children and her students. And then the last one that I really liked was a 23-year-old who said, "Why take a chance of a terrible disease when it's preventable?" So I really loved the service that we got back on that. We really didn't have a way to measure the impact, but like I said, it was all very well received. Everything was very well received. I talk about HPV vaccinations at all the outreach events that I do, including health fairs, and anecdotally, I have seen a large increase in people and kids saying that they've had the vaccines. So at fairs in 2016, most adults knew about the vaccine and had had their kids vaccinated, which was a big change from even just the year before that. Some still didn't realize they needed their boys to be vaccinated. Some still didn't know that about the vaccine. Very few. Most of the adults knew about it. Most of the kids thought if I said it was a series of 3 vaccines, they said, "Oh yeah, I think I've had that." And if they didn't, I give them a little pamphlet that says, "Talk to your folks about this." And we do have some that are opposed. We have some anti-vaxxers. We try to talk to them about that. There has been a marked increase in those who responded that they've had the vaccine or had their kids vaccinated, and they're very positive about it. So with the video and the other things that we do, I think we're making great progress. I did, because we didn't have a very good turnout for the medical providers. I followed up with many of the people that I know, and they all said that they didn't know about it. So what happened, I think, is they got the postcard, and they probably got tossed before the doctors ever saw it. Or, doctors are really busy. They probably just went through the mail like this and didn't think about it. So we didn't do any other kind of follow-up except from the surveys. But I thought the surveys were really good. And then we sent the evaluations to Midwest Cancer Alliance, so they would have them. So I have lots of lessons that I learned. Don't do an event when the kids are out of school if that's the population you want to reach. So this happened in June and in January, and so the school nurses were out and didn't attend the medical one, and then the college kids were out in January, which is who I wanted to reach, and because they were still on break. And so you can tell I don't have any kids, but so that was one lesson learned. Never plan anything when there's an at-home college game, or try to work around the school functions, dances, graduations, ball games, other big community events. I found that this is nearly impossible these days. It's something every single day, so we just have to hope for the best. The time of 8 p.m. to 10 p.m. is too late. Having the doors open for the health fair that we did for the public, and then and the health fair and food, and then we opened at 5, and then we didn't start the movie till 6:30. Way too long. We probably should have opened at 6 and showed the movie at 6:20 or something. I mean, 15 or 20 minutes, and then we could have kept open if they wanted to do it afterwards. But so what happened was people came, they ate, they registered for their door prizes, and they left before the video started. So we learned that lesson. Advertisements with the color red on them work really well. I learned that from a colorectal screening that we did, and that is something that if you do color ads in the paper or on Facebook, it's a really, really, really good thing to think about, is for having the person wear color red. It works really well. It just jumps out at you. The cards that we sent to the offices, I think they were a little too busy. We used some that someone else had used prior to us for this event, and it didn't really have a title on it that we think that we should have used now that we've seen the movie and done it. So I would change that. Well, my advice is to pay attention to everyone's lessons learned. Hopefully, there's going to be several people that have things that happen to them. I would mail a personal sealed letter to each doctor to invite them next time. Um, I would personally go to the schools and the colleges and to figure out the best times to offer these things and the best way to get the word out to the kids as folks and maybe to the kids themselves. I would get the school nurses involved, and like I said, I tried to do that, but we had chosen the wrong times, so that was my bad. Having a physician champion is a major plus. It really should have that because people respect the physicians and then they believe what they say. As I look at the flyer for the June 16th program, I think it was too busy and the title wasn't really what I'd like it to be. One thing I would change about the movie is if we could make it shorter because it's about an hour and a half. That's really pretty long if you wanted to have a panel before or after or do anything else along with it. I'm not criticizing the movie because it's just fabulous and they really needed that time to present all of the things that they did. But a lot of times people don't want to commit to that much time for an after work event. If they could do a condensed version or something, that would be great. And I would love it if we could have a video about head and neck cancers in men and women as well. That would be very powerful.